Hello and welcome to Smaller Stomach, Bigger Life. We have a podcast and we also have a fabulous online community. I'll put links in the episode notes and on the video notes, depending on how you are reaching out to us to join that fantastic community. We would love to have you. Today, I'm going to talk about a subject which is almost, I think, universal: weight regain. Now, this is the fear of virtually every patient that I've coached through their surgical journey in the last 15 years. Everybody is scared of the weight come back. So let's cover first why we're scared about why the weight will come back. And the simple one-word answer is evidence. That's what we know, because generally, someone that comes for surgery and prepares for surgery, they have had years behind them of dieting, of losing weight, and then of regaining that weight, and then of blaming themselves for the regain of that weight, then of feeling shame and judgment and guilt, all these sort of negative emotions around it, and then ultimately feeling like they have failed. Few people go, well, hold on, the diet failed me. There's that sense of internal failure. It's my fault. Other people succeed at this, but not me. So imagine you've done that 20, 30, 50 times before you actually go into your surgical journey. Well, obviously, that's the evidence that you're going to carry with you into your surgical journey. And it's going to make you go, well, what's different about this time? Actually, someone recently in our community posed this as a question. She's about to go in for surgery. And she said, what's going to be different this time? And I replied, well, the difference this time is the surgery. Now, even if you've had surgery, it doesn't mean you're home and dry. That risk possibility of weight regain is still there, but I'm going to cover why weight regain might happen and also how you can protect yourself against it. So a lot of people come into surgery carrying huge emotional stakes with them. It feels like the last chance. It feels like if this doesn't work, nothing will, and I can't go back there again. This has to be successful. We put a lot of pressure on ourselves, I think. So the thought of losing that progress feels terrifying, not just physically, but emotionally and socially. What might happen on the other side if I regain this weight? How am I going to feel? It's not just the weight regain, it's the judgment, it's the social acceptance problems that might cause. And all this, to be honest, is a really human reaction. This is really normal. Think about this. Think about the evidence that you go in with. The fact that this has happened before is going to make you think it's likely to happen again. So let's normalize the first thing. Some weight regain after bariatric surgery is biologically normal. Most patients on this journey hit a low weight and then they tend to stabilize slightly above that low weight that they've got to. And the problem is people often forget where they originally came from and they see that little tiny bit of weight regain as a failure. And it's really not, because sometimes they've come from, say, 150 kilos, they've gotten down to 80 kilos, and then they bounce up to 85. And what they forget is that huge weight loss they've had. They just look at that little 5 kilos and go, oh dear, I failed. But this is completely normal, a little bit of a bounce. The problem might come if there's significant regain that's maybe driven by either behavioural issues or possibly medical factors, but we'll go into both. So surgery changes your stomach, your digestive system, but it doesn't permanently change your habits, your emotional eating patterns, your food environment, your stress responses, your coping styles. Those things may need ongoing attention. And that's why it's really important to have either a good surgical team around you, but even if you do have that, having that sense of community, which is why I really, really implore you to join us in our community. We're ad-free, so we're not like a Facebook group. You don't have to scroll through millions of ads to get to us. And it's a community of like-minded people who are all on there helping each other. It's a really fabulous community and lots of lovely people involved. So let's have a look at the sneaky behavioural causes of weight regain. And this tends to happen quietly and gradually. So it's a bit stealth. You're not necessarily going to notice it unless you're kind of keeping check on yourself and what's going on with your. So the number one, so if we get somebody that comes back to us, because I work in 2 private practices, if we get a patient that comes back and says, I've regained 10 kilos or something like that, the first place we look when we review their intake is liquid calories. Liquid calories are the number one enemy, if you like, of any bariatric procedure, because they pass through you really quickly. They don't trigger that real fullness prompt that we have. So, our stomach doesn't really register that I'm full, stop eating, I've had enough, because they don't really stretch the stomach because they pass right through. They're really easy to consume in excess. And also, we don't get those satiety signals, the same ones that we get if we have solid food. So think about the things that are coming into you in liquid form. I tend to say there's what I call the big 3, which is chocolate, ice cream, and alcohol. I know some of those fall into a category I'm going to tackle in a minute, which is called sliders. But for me, what I've observed anecdotally over the years is that chocolate, ice cream, and alcohol tend to be the things that are to blame. But there's other things we've got to watch for as well. It could be those caramel, vanilla, latte type, milky type coffees where there's lots of syrups in them. If some people are having a lot of those every day, well, that's going to tick up the calorie count. Juice as well is a common one. Juice is, quite a high sugar content. Anything sort of smoothie based instead of a meal. I tend to say, if it's a liquid, it's not a meal, it's a drink. Alcohol, obviously, as I've said, soft drinks as well. Full calorie soft drinks can really affect you. So really the first sweep we do is we get someone to do a food diary. And then we say, okay, let's look at that food diary and perhaps go along with a highlighter and mark out where the liquid calories are. What's going into you easily in liquid form? We might find the culprit there. If we don't find the culprit there, we look at what we call sliders and crunchers. So as the name suggests, sliders are soft, easy to eat foods that go down effortlessly. They don't cause any sort of resistance, if you like. So things that might fall into that category. And as I said earlier, I mentioned chocolate and ice cream in the liquid category because by the time it's in us, it is liquid and it goes down easily. But those are also slider foods, slide down easily. Things like processed snacked foods, things that you really don't kind of realize you've eaten in quite the quantity you have. I also include in this category things like sauces and saucy meals. You'll find, for instance, you can eat more quantity of a slippy, slidey, casserole type meal than you can of steak and vegetables and potatoes, that sort of thing. So it's the consistency of the food. If it goes down easily and you sit back and you go, oh, I'm surprised how much I ate of that, those are the very sort of foods you've got to be a little careful around. And crunchers, well, as the name suggests, things that start off big and end up small. Potato chips, popcorn, pretzels, crackers, those sort of things where you think actually you're not going to get through the amount that you do. And I tend to give an example here. And I say, if you get a bag of potato chips, for instance, and you just, one of those huge bags, and you smash them all into the tiniest pieces you could smash them all into, how many crumbs would you have in the bottom of that huge bag? Not many. That gives you an idea of, that little pile of crumbs that would be at the bottom of that potato chip bag is probably going to easily fit into your stomach, regardless of what procedure you've had done. So these are the things we've got to think of. If it's easy to overeat, if it goes down easily, if you really don't feel that sense of being properly full afterwards, those are exactly the foods you've got to be careful of. So we tend to do that if someone comes back to us. We do a sweep of liquids, what liquids are going in, what crunches and sliders are going in. I often say to my patients, you will never regain your weight eating fish and meat and chicken and eggs and, all those sort of protein sources. You will never regain your weight by eating those and vegetables or salad. It's just not going to happen, because those foods, you get a real sense of satiety, and that sense of satiety is what stops you eating and limits your portion size. Another really good way to regain the weight is grazing. Grazing versus structured eating. So eating small amounts throughout the day, again, where you don't get that sort of real sense of satiety. Picking up food, sort of saying, oh, I won't have a proper meal, I'll just have a nibble of this and a handful of that and a slice of this and a small portion of that, and just kind of, getting through the day without actually sitting down and having a proper meal time and a proper meal in front of you, and eating until you get that proper sense of satiety. So that kind of bite here and there, you will be surprised how much food that amounts to over the length of the day. So grazing, not the friend of bariatrics. Ideally, get into a structured system where you have breakfast, lunch, dinner. In the early days, your dietitian will probably structure in a couple of snacks for you, because your breakfast, lunch, and dinner are simply not going to be big enough to let your body survive well between meals and be nourished. But as time goes on and your meals actually get big enough, ideally you want to cut out those snacks and go into that classic breakfast, lunch, dinner sort of routine with pauses between those meals. So another thing is what we call emotional eating, although that word can mean different things to different people. But sometimes our eating patterns change when we're under a lot of stress, or something emotional is going on in our lives that we're finding difficult to cope with, or we're bored, or we're lonely, or food ends up providing some sort of source of entertainment almost for us. So when those coping habits resurface, it's important to maybe get help. So someone like me, some sort of therapist or psychologist that's on your team, or call out to the community group. That's what we're there for. And our community group, by the way, is free. So join us, because there's help there right away, and helpful hints about how you cope with emotional eating after surgery. It's completely doable. You don't have to throw your arms in the air and go, this is me, this is just who I am, there's no solution. There are solutions. Now, the very last thing I want to cover briefly is there could be perhaps a medical reason for weight regain. So if you've gone through all those other reasons, if you've really addressed the possible food and behavioural reasons why this might be happening, that would be then the time to go back, see your GP or see your surgeon if you're still in contact, and say to that team, can we just check there's nothing medically that might be affecting this? So there's going to be a metabolic adaptation that occurs, which will mean afterwards that your hunger hormones may rise because of the amount of food you're getting in isn't actually enough, and your body realizes that and raises your hunger hormones. Your satiety hormones will drop because you're not getting as full and you're not getting as much of that hormone on board. And your energy expenditure may decrease because your body starts to use the food it is getting in the most economical way. So this isn't sabotage. This is your body's biological adaptation to what's going on and what your body sees as the bigger picture. We haven't got enough nutrition and we haven't got enough calories and energy on board. What are we going to do to balance that out? So there will be this metabolic adaptation that occurs. You do have to consider that, but it shouldn't really be having a profound effect on your weight. It will be having, that's that period of adjustment that I talked about earlier on, about your body just kicking back a little bit because of that metabolic adaptation. There's other things you need to look at, and one of things might be medications. Some medications we know increase your appetite. Some antidepressants, some steroids, insulin perhaps if you're diabetic, some psychiatric medications as well, and some hormonal treatments might affect your weight and cause some regain. So maybe check in with your GP and say, look, these are the medications I'm on. Are any likely to be responsible, perhaps, for my increase in hunger or my weight regain? So other things to consider, and again, this is sort of not going to apply to everybody, but again, it's worth checking out. Some thyroid dysfunction might affect your weight. PCOS, menopause changes, insulin resistant shifts as well, sleep apnea relapse. So a lot of people that disappears with weight loss, but maybe not, and it might come back. Or some level of chronic inflammation. So again, if you feel this is happening to you, if you feel that whatever is going on is not food or drink based, go back to your medical team and have this checked out. Very occasionally, and this is much less common than you would maybe hear about, very occasionally, your surgery can dilate, so your pouch can get bigger, your sleeve can stretch, outlets can widen, and that can happen, but as I say, rare circumstances. A lot of people worry so much about ruining their sleeve. I've stretched my sleeve because they've had one big meal. Doesn't really happen like that. So we are looking at this being less common, but it does happen in some cases. So again, a trip back to your surgeon. Your surgeon may decide to do a gastroscopy, have a look what's going on down there. They may send you for something called a barium swallow, so they can actually see the passage of food moving through your digestive system and see if there's any holdups anywhere or whether things are what they expect to see. So they may send you off for some sort of diagnostic testing to see if there's anything actually going on physically. And even if there isn't, don't worry if you don't find your answer there, because it's possible that in itself can put your mind at rest. The fact that you know that actually nothing is wrong with the surgery, everything is still as you would expect it to be, then you can eliminate that as a cause. So as I say, these medical things are kind of a last resort. By far, 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 the most common culprit is something you're eating and drinking, or the way you're eating and drinking. So have a look at that first before you get your head into thinking it could be something medical. So prevention strategies that actually work. And this isn't anything extreme or obsessive, just effective strategies. And it's a kind of going back to basics. The first one is protein first, even years after your surgery. It protects your muscle mass, it improves your satiety, that sense of fullness you get. It stabilizes your appetite and it supports your metabolism. So if your protein is slipping and you go, actually, the other night, all I had was a portion of chips for dinner, then you kind of might be able to steer yourself back into something that's more protein based. Make sure there's always protein on your plate and make sure it goes into you first. Eat meals, not snacks. So if you find that you've drifted into that snacky domain, go back and say, no, I'm going to make an effort to have breakfast, lunch and dinner. Because generally we fall into snacking if we've skipped one of those meals. So getting back into structure, super important. Keep your liquid calories rare. I mean, obviously something like water, go for it. But generally review your liquids and go, what of my liquids is calorie containing? And those liquids, try and pull back on those. Watch those crunches and sliding patterns. If anything goes in too easily, those are exactly the things that you've got to worry about. Ask yourself, am I eating this because it nourishes me, or am I eating it because it goes down easy? Ease is not the goal here. Nourishment is. So Exercise, sorry to bore you with this one, but building a bit of muscle, doing some strength training will improve your metabolism and therefore help keep that weight regain at bay. And the last one is stay connected. Just because maybe your surgical or medical team has let you go, remember this is a lifelong journey that needs lifelong support. You can get that support and you can give that support in a community group like ours. So you can be the inspiration for some of the newer people coming through. Also, we are there when you need us, when something, for those days where you have a bit of a wobble, we can be there for those days as well. So if regain starts, act early, not emotionally. Don't panic. Don't feel shame. Don't feel a sense of failure. Don't hide away. In fact, do just the opposite. That's the time to show yourself. Ask for advice. Reconnect with your team. Seek help on a community page and install all the tips I've given you today, and you should be back on track pretty quickly and easily. I tend to say people for the first few years, particularly for those people whose weight has been up and down and up and down, we have a very poor perception of weight regain. We don't really feel it in our bodies until it's got to the stage where, whoa, okay, I've gained 5 kilos now. We don't feel half a kilo. We don't really feel a kilo even. So the scales, even though I don't want you to get obsessed about weighing, the scales are kind of your friend in those first few years, just to sort of see where you are and check in. Am I in my comfort zone or am I starting to creep? So it's worth keeping your eye on the scales. So being successful with surgery is not about perfection. It's about consistency. It's about patterns, small patterns that you repeat and you kind of do the basics well. So I hope today has helped you put your mind at rest, hopefully, as I say, about the number one fear. If you ever wobble about this, you're not broken. You're simply being called back to the basics of structure and support. So join our community for more tips, and I hope I'll have your company next week on today was the first episode of this new podcast, but I hope you continue to stick with us. And if you know anybody that has had surgery or is on a GLP-1 medication, perhaps send them along and get them to listen to us, because there's lots more to come. You've been listening to Smaller Stomach, Bigger Life, and I hope I get your company next week. Thank you.